Okay, guys, so this video is going to cover slides 12 and 13 because they're related to the same thing. So we're trying to understand when a, quote, normal behavior is excessive. And when it comes to sexual behavior, just like food behavior, this is tricky because unlike cocaine or heroin or OxyContin or alcohol, sex and food are things we need to survive. They are part of our human DNA. They are part of our biological drives as much as they are also influenced by social and psychological and spiritual things, right? So when we're talking about something that's part of our biology and part of our evolution, it's a little bit difficult to say, well, what's too much of that? Especially when we know things like sexual drive vary naturally across people, and some of that is, in fact, genetic. So when is a, quote, normal behavior excessive, right? Now, in the 1940s, total sexual outlet was originally defined by Kinsey and colleagues as the number of orgasms people experienced per week. And that is actually one way that some researchers and clinicians have argued perhaps we should look at what hypersexuality means. Now, Kinsey is a very well-known sex researcher, and the Kinsey Institute became one of the largest research facilities to study human sexuality. Number of orgasms per week. Well, I want you to think about this one for a minute. What's wrong with using the number of orgasms a person experiences per week to determine what, quote, normal sexuality is and what, quote, excessive is? I want you to think about that for a minute. Just stop and think about that for a minute and why that could be very problematic to use to define hypersexual. Okay. Now, in the 1990s, that same person I mentioned earlier in this lecture, Kafta, defined somebody as hypersexual if that person had greater than 7 orgasms per week for over 6 months after the age of 15. Okay, so let's think about this one. You're hypersexual if you have more than 7 orgasms per week over a 6-month period and you're not a teenager going through puberty. Now, if we were in class, I'd say, anybody see a problem with this one? Anybody? So think about that one again. Take a moment, reflect. Got a problem with that one? I do. Where in the world did this number come from? Who's decided that 7 was the magic number and more than that means you're a sex fiend and you're hypersexual and clinically sexually disordered? Who made that decision? Now, they claimed that they got this from surveys, which show that only between 2% and 8% of men, including adolescents, reported persistently having greater than 7 orgasms per week. Now, I want you to think about this one. Number 1, what is wrong with relying on surveys that are self-reports of sexual behavior? Do you think people would necessarily tell the truth? Why might they not tell the truth? And why might people, if they were not going to tell the truth, underreport the number of orgasms they had per week? Why wouldn't people necessarily be happy to report they have 20 a week, even if they did? Now, next problem. Let's say they are being honest. What's wrong with using a survey of what people say their average number per week is to decide who needs help and who has a clinical disorder and who's hypersexual? Think about this one for a minute, because this is what we call a statistical deviance model of defining abnormality. If most people say X and you say Y, that means you're disordered. Well, what's wrong with that idea? I want you to really think about that. What is wrong with using the average to decide what's normal and what's excessive? Especially when it comes to a behavior that varies in part biologically and is part of our human nature. Okay, think about that. And let's move on. Kinsey, in 1948, and his colleagues found that only 7.6% of American males from adolescence to 30 years reported a mean total sexual outlet per week of greater than 7 orgasms for at least 5 years. And so that's where that number came from, that 7, and from the more recent research in the 1990s. Now, again, what are the problems with using this kind of data? Survey research, self-report, also that varies by decade. Think about norms. Think about social norms. Think about cultural norms. Think about sexual norms. It's going to switch over time. It's going to shift over time, right? So who's to say what's normal and what's not? Some of that is dictated by cultural norms, social norms, and people might not even report certain things because it goes against the cultural norm, and they fear stigma, they fear ostracism. In a more recent set of surveys in American males, 14.5% reported masturbating between 2 and 6 times per week for a current year. 1.9% reported daily masturbatory activity, and an additional 1.2% reported masturbating more than once a day in the past year. So what does this tell you? Think about this. Isn't it interesting that more recent surveys reported much more frequent self-pleasuring, much more frequent incidence of orgasm? Are we going to now call the average hypersexual? Because in 1997, even, the data would show that as hypersexual. Now people are reporting more frequent engagement in sexual activity, more frequent orgasms, so the average has shifted upward, so that's no longer hypersexual. Do we see the problem with using this kind of data to define clinical versus non-clinical appropriateness, clinical diagnostic behavior versus, quote, normal behavior? Okay, so follow me on to the next slide, slide number 14. What's wrong with these definitions of hypersexuality? And again, I want you to think about these questions, okay? Norms change both intra and interculturally. Intra, within the same culture across, let's say, a 40-year period, the norms change. That means a couple things. People may actually be more comfortable engaging in greater levels of sexual activity because they no longer feel ostracized or stigmatized. Second, if the norms change and make it more, quote, appropriate or normal to have sex more often, people might be more likely to be honest and report their true activity, whereas maybe 40 years prior, they were having sex more frequently, but they weren't reporting it because it wasn't, quote, appropriate. Interculturally, in the same point in time, what is normative in one culture is not in another. So who's to decide which culture is the normal culture and which culture is the hypersexual culture? At any given point in time, those averages differ depending on which culture you survey, right? Where are the women in this data, by the way? Did you notice males were surveyed, males were surveyed, males were surveyed? What about women? Do we not care what the norms are for women to decide what's a hypersexual woman versus a normal woman? What about individual differences in sex drive? It is normal, healthy, and even partially biologically driven for people to have fluctuations in their sex drive over time as hormones shift and as they age and things of that nature. But also just genetically, some people have a higher sex drive across the lifespan than others. So who's to call one level hypersexual and the other level normal when this is something that varies across people? And by the way, should amount of sex or amount of orgasms or frequency of sexual activity be the deciding factor in what's diagnostic and what's normal? Or should the reasons people engage in sex however many number of times, twice or 200 times, should that be more important for defining hypersexuality? Like if you're having sex 10 times a day because you enjoy it and you enjoy sex and you have a healthy perspective on sex, why is that hypersexual? But if you're having sex twice a day or twice a week, but it's always because you're angry and vengeful, isn't that more problematic than the number of times that a person engages in sexual activity? And let's take this to an even grander level. Does the concept of hypersexuality even make sense to you? Is this even something we should be talking about as a clinically important construct? Or is it ridiculous to call sexuality, which is a normal human function and a normal human experience, is it just ridiculous to pathologize that at all? There was a time when women who enjoyed sex were considered nymphomaniacs, were pathologized. Now it's considered healthy for women to be sexual. So you have to ask yourself, when it comes to something like sexuality, are we playing a dangerous game by pathologizing it? Because cultural norms shift, and that influences so much of what we consider to be, quote, normal sexuality, and how much people are willing to disclose or report. So the data, depending on what era we're talking about, might not even be accurate, might not even be honest, right? Okay, so let's meet up on the next slide and talk about a different way of thinking about sexuality and maybe when something is clinically relevant and when something isn't. But think about these questions. I really want you to think about this and what makes sense to you and what doesn't.